Hello, everybody. Welcome back to the Integrity IPG podcast. My name is Jordan Pahalik, one of your two co-hosts. Joined with me today, as always, is Dylan Webkenberg.
How's it going, everybody?
CFB. And then we have a special guest today, which is exciting because it's our first guest of the podcast as well, Sam Adler.
How's it going?
So, like I said, very excited today with it being our first guest. So, without further ado, if you wanted to just tell everybody a little bit about who you are, what you do, stuff like that.
Yeah, so first of all, thank you for having me. This is really an awesome opportunity for me. My name is Sam Adler. I work for a local insurance agency. I specialize in health insurance and Medicare for individuals. I do insurance or health insurance for small businesses across Metro Detroit as well. And so I really, really love Medicare, and I think that's how me and Dylan and Jordan first got connected.
Yeah, that's exactly right. Kind of going off of that, I know that there's a lot of people out there that either aren't interested in Medicare or don't know anything about it. For those people and for young guys like us, how would you explain it? What is it basically without boring everybody out there?
Sure. In one or two sentences, Medicare is insurance for people who are elderly or disabled. So if you are 65, you qualify for Medicare and you can get federal health insurance. Or if you've been on disability for 2 years, you also qualify for Medicare and you can get much better insurance for a much better price. And the government helps you out with your copays and makes costs more manageable for you.
Okay. Good little breakdown, which is important because most people out there that are working at their job from now until retirement, their employer is the one that's kind of paying for their health insurance, correct?
It's amazing how many people really don't know what they need to know about insurance. And there's nothing wrong with that. But for 30 years, they work a job. HR comes in once a year, plops a packet down on their desk and says, this is what you get. And, they put it in their car, file it away in their desk, and they flip through it. And then, they don't really look at it until something happens. And Medicare is totally different than health insurance. So that transition, usually there's a lot of hand-holding and there's a lot of new information that kind of needs to go into that.
I can imagine, yeah.
What interests me is, and it's sort of similar with financial planning. I mean, we're talking to a lot of people our age too, but you being young like us and dealing with a lot of people that are entering that later stage of retirement, 60s, 65, what attracted you to doing a job like this of helping that older generation?
It's a great question. And I always knew I wanted to be in like a relationship type selling role. And I used to teach tennis.
Okay.
And I worked at country clubs, and the average demographic at a country club is about a Medicare age.
Yep.
Yeah.
And so I got a lot of time working with that demographic. I got really comfortable with that demographic, and I learned that I really like working with them. And I hurt my shoulder. I couldn't teach tennis full time anymore. And so I was thinking to myself, what is more exciting than teaching tennis to the rich, the famous, and, the high level athletes? And I said, Medicare insurance.
Of course.
That's my joke that I tell everybody. But like I said, I always wanted to be in like a relationship selling role. I always wanted to help people. And I got into insurance because I wanted to protect people. And I love it.
I like hearing that. Kind of to that same point, what about your job do you think you value the most, or what's your favorite part of it? It sounds like the assisting people and helping people is definitely up there. Kind of the same thing for Jordan and I. But yeah, is there anything different other than just the assisting side of things?
I love helping people with something. I mean, this stuff is really complicated and they don't make it easy to understand. And so helping people, I love. But beyond that, I mean, half of my job is going out and making friends. There's so much compliance and marketing guidelines with Medicare and health insurance, and there's so much fraud that I've just decided I'm not going to do any of it.
Mm-hmm.
I'm going to go out and I'm going to make valuable connections. I'm going to do stuff in my community, and I'm going to hope people find me like that. And I'm going to take care of the people in our community. I'm only licensed in Michigan. I think if I do, insurance outside of Michigan, I don't know the markets, I don't know the hospital systems, I wouldn't be doing as good of a job since, I'm here. I have experience with the hospital systems and I know the doctors.
I love hearing that. I can think back to our first time that you and I met each other. It was like a year and some change ago at least now at a networking event. Mm-hmm. And I was just introduced to you and I was like, all right, this guy seems like he's energetic, go-getter. I knew I had to just bring you into my team basically. And it's awesome seeing how both of us have grown, especially you though. And I wanted to kind of give you a shout out for the It was you had an award for Plymouth, I believe. Do you want to talk about that a little bit? Just
Sure.
give yourself a pat on the back.
So I love chambers of commerce. I think chambers of commerce are so good for the community and really, really good for local businesses. So one of the things I did to help kind of get my name out there was join chambers of commerce and start getting out into the community, getting involved with the city. And so they have a demographic or a crew of people called their ambassadors. When new people join the Chamber of Commerce, the ambassadors kind of welcome them into the organization, take them to an event, take them to a cup of coffee. And so when I started joining the ambassadors or doing more with them, the guy who runs the Plymouth Chamber approached me and said, the majority of our ambassadors are in their 50s and have been doing business with the same ambassadors for the last 10 years. And the young people are the future of our city. And so we want you to create a young professionals networking group in the Plymouth Chamber of Commerce. So for over a year, I've been building this networking group. We've done, I think, coming up on 10 events.
Yep, yeah.
I've got over 100 people on a list that come. It's truly something that I am incredibly proud of. And the Plymouth Chamber of Commerce gave me an award, the Volunteer of the Year award, for getting so many people involved in this cool new thing. So I love young people, and I think young people have a lot of good skills to offer our community, and so I want to try to help them too.
Totally agree. And you do a great job at it, by the way. Whenever we're talking with, because we do the same kind of networking stuff for our business, we're trying to meet people that would be good relationship builders and referral partners and things like that. And your name is at the top of the list whenever it comes to, oh, who should we add? Who should we include for this kind of networking group? And it's always Sam Adler, Sam Adler, Sam Adler. So had to give you a shout out there for sure.
I really appreciate that. And you guys, I need to give some props to you guys too, because this is awesome. I love this idea. And you guys are real studs in our local chambers of commerce. I mean, you guys are regulars at all the Novi stuff. I was in the Novi, still am. It's not like I'm not anymore.
Right.
But I do a ton with the Novi Chamber, and I'm always seeing some representation from, your guys' organization.
Well, thank you for saying that.
Yeah.
Yeah. And you have another event coming up with the Plymouth Chamber, right?
I do. So on June 24th, we run an event. It's like once a quarter, sometimes a little bit more than that. So on June 24th, the young professionals are going to host an event. We're going to try something new. We're going to open it up to anybody. Normally, we cap the attendance at about 35 or 40 years old, but June 24th is actually my birthday, so we're going to do like a networking birthday party type thing. So I'm going to host it, open it up to anybody, and see how many people come.
I like that.
Do something fun. Yeah.
There you go.
That's what I was going to lead into next. Happy early birthday.
Yeah, right.
I appreciate that.
Yeah. So moving on, I would say another question that I've been dying to ask is, what would be one thing that you think Medicare surprises people just learning about? There's so many unknowns of, feel like leading up to that age, you really don't know what you don't know. So is there one specific thing that you would think shocks somebody to find out once that time comes?
It's a great question. And all the time people say to me, what is the biggest misconception in your industry? Or what do people think that is totally wrong? Or the biggest misconception in the Medicare space is that people don't have to do anything. You turn 65, I get Medicare. For some people, that's the case. If you're taking Social Security, getting onto Medicare is a lot easier. But if you're not, if you're still working, you're on group health insurance, or you're not taking your Social Security yet, there's a lot that you have to do. Sometimes there's some paperwork. Sometimes there's not a lot of paperwork. Sometimes you need to make an appointment with the Social Security office. So the most important thing is get an opinion from someone like myself, even if it's not me, but just talk to a local advisor, somebody who's a real fiduciary, and say, hey, I'm turning 65. This is my situation. What do I do? Because all the time I see people who wait, they don't do anything, they pay these big penalties. And, even if you're not going to buy something from me or the local agent that you're talking to, just know that you're doing the right thing.
I can imagine that for a lot of people, one of the reasons why they might not want to even get into a meeting or a discussion about Medicare with you is because they're afraid of how much information it might be, or they're afraid of how much that information might cost them from you. Yeah. Can you answer both or either of those questions? And is there truth to that? Is that a misconception?
Medicare is complicated, that is for sure, but it's against the law for somebody to charge for Medicare enrollment. And so I am compensated by the health insurance carriers. They pay me a small commission every month to keep the client happy. And so I describe my job as running interference between the carrier's customer service line and the client, because I do a lot of support on a day-to-day basis. And I run my business. It's me. I'm the support, I'm the new business, I'm the prospecting, I'm out sponsoring events and all this other stuff. And so you have a problem, you have my cell phone, you call me.
Makes sense.
Yeah.
Oh, and the other piece of that is, like I said, it doesn't cost anything.
Right. Yeah. Okay, so it's free information for people out there.
Yep.
Doesn't seem like there's any real reason to not want to explore that.
Right. And so that's why I say, even if you're not going to buy anything from somebody, just call a local professional, make sure you're doing the right thing for you, and go from there.
Yep.
Yeah. What would you say is the age people should start, looking to get some of that information?
Yeah, good question. Should we start looking at it like right now? Should we?
Anybody who's thinking about retiring is a good candidate. If you have work health insurance and you've done really well and you're 40 years old and you want to walk away, you're going to benefit from a conversation with me, because I don't only do Medicare, I do private health insurance for individuals as well. If you are turning 65 at some point in the next year, start getting information early. You don't want to be the person who's going to Social Security and applying for Medicare 1 month before your birthday, because it may not get processed in time.
Mhm.
So, you can start applying for Medicare up to 3 months before your birthday. And so that's always a good time to start looking for local professionals. But even earlier is a good time to kind of get the ball rolling and figure out what your course of action is going to be.
And just like financial plans, Medicare decisions are like set it and forget it. You never have to talk about it again or look at it again.
Not exactly.
I don't know. I was just making it.
Oh, okay. Some plans are a lot less complicated and they change a lot less. Other plans change all the time. Prescription drug plans is a big one. If you're on a Medicare plan, you have to have a prescription drug plan. Those plans change every year. And the premiums on them change and the formulary on them change, which means the drugs that they will cover and how much of the drugs they'll cover will change. And so at least taking stock of your prescription drugs every year, running it by an agent really quick is super important. Some of it is set it and forget it, but those prescription drug plans, if you're on a Medicare Advantage plan, you're going to want to talk to someone on a regular basis.
Got it. So like a regular isn't like an annual, more or less,
Yeah.
basis. Okay. As life changes,
Yeah.
things go up to. Okay, it makes sense.
There are open enrollment periods. You can only change your Medicare Advantage plan between October 15th and December 7th. So if you are thinking about it, put it in your calendar now, call somebody way ahead of time, because during those 6 or 8 weeks, agents are always just slammed. So if you have questions or concerns, like I said earlier, getting ahead of it, reaching out way ahead of time is always good. I imagine that's similar with your guys' stuff too. You probably want a
Definitely.
very long runway for some of
We want a long runway, and the idea is that it's what we like to say. It's not a 30-year plan. It's 31-year plans.
I like that a lot.
What you set up right now is more or less the same idea now until retirement or for the next 30-year runway. But life changes and things change, and even personal preference changes from now until then. So it's kind of those minor tweaks each year that you get to make, but you're not really changing the ultimate structure of the plan. You know what I'm saying?
Yep. And we're sort of like that too. This is what I want. These are my health needs. I want to be able to travel. What plan is going to help me keep my doctors and keep my, co-pays at a reasonable price?
Exactly. Yep. Yep.
That's why we were so excited to bring you in, because there's so many, obviously it's a completely different field, but there's so many similarities in the work we do. And there's a lot of stuff we do jointly. There's a lot of our clients are similar age, so need that similar, information
Totally.
or just to work with somebody like you. So again, that's why we were excited to have you on. I'm curious too, the process that you take new clients through. So like we have a similar process. I feel like obviously it changes per person and what their needs are, but do you have like a structured process that you walk each person through, or is it kind of differ based on who the person is?
I'm very needs based. Like I said, I'm only licensed in Michigan, so I try to do everything in person or hands on. I love in-person appointments. Some agents won't do in-person appointments. I love sitting across from somebody, having a cup of coffee, reading their body language, learning what makes them tick. And so I always start with a phone call. I get a lot of emails. Hey, Sam, I'm turning 65. What do I do? I always call them because I want to talk to them on the phone. I want to learn a little bit about who they are. I want to learn a little bit more about what's going on. Then I usually try to book an in-person appointment. It's a consultation, doesn't cost anything. And generally during that in-person appointment, I take prescription drugs, I take their doctors, I take how much they're paying for their insurance right now and what they've got. And then we try to come up with a plan. Now, that plan is not always drop your work insurance and get on Medicare. There are times all the time where I tell people, hey, you're working right now, you're paying a really reasonable rate for your insurance. You don't need to do anything until you decide you want to retire. And so my process, like I said, it's very needs-based. It's very feel-based. I'm never going to say you need to do this. You have to do this. My job is to present options and the client's job is to make decisions.
Yeah, makes sense.
Yeah. Yeah, I feel like that kind of leads into the next question too. There's myths in every sort of industry, and I feel like some people hear Medicare and they hear, okay, there's a certain age and then that's just the time to enroll or straight go into that, when that's not always the case. Um, so would you say there is a certain myth or, we've kind of covered this, but misconception out there that many people tend to just believe that's the one-stop shop when it's like, this is what we have to do at this age or something along those lines?
Sure. Kind of product specific, Medicare products have evolved a lot over the last decade. They've gotten way better than they were when they initially came out. And I know I'm young and I've only really been in the business a couple of years, but when Medicare Advantage plans first came out, genuinely, they used to be really bad. You used to have an HMO, which means you can only see a specific list of doctors and hospitals, and you have to operate within that list, and they made getting prior authorizations a really annoying process. We're really blessed. In Michigan, we have some awesome Medicare Advantage products that are true PPOs. You can see any doctor you want so long as they bill Medicare, and they really are very, very cool products. Now, I'm not saying a Medicare Advantage is the answer for everybody, but there are a lot of people who come into my office, they sit across from me and they say, Sam, whatever we talk about today, we're not talking about Medicare Advantage. Medicare Advantage is awful. I want to be able to see the doctors I want to be able to see. And to them, I say, hey, look, that's totally okay. If I told you there were plans where you could see any doctor that billed Medicare, would you have any interest in listening, or learning more about Medicare Advantage plans? And generally the answer is yes. And so recently, I guess the biggest myth or the biggest misconception is just come in with an open mind. There are products that have gotten a lot better and evolved and changed a lot, and things aren't the way they used to be when these Medicare Advantage plans first came out.
Yeah, there's a lot of overlap with our industry too. It's like our coworker Jim, he always kind of mentions that like products are what they are. They're like a tool in your golf bag or any kind of club you can use, and you use them at certain times. So if you're using like a putter when you're supposed to be driving, then obviously someone that is in that product would say, this is terrible. I never want Medicare Advantage. Why am I putting with the driver? You know what I'm saying? So
exactly.
When you use a product the wrong way, then most of the time someone's going to have some negative outlook up because of it, but it doesn't just mean that is what it is. It's a situation that happened,
And it's one of the reasons why I specialize in Medicare. It's because there's a lot of health insurance agents out there, and selling some Medicare products is really easy. Selling other Medicare products is very hard. You need to do an annual training. Then for every carrier you want to represent, you need to do a carrier training. Then you have to take an exam about the products. And so some people who do health insurance or group benefits also do like a little bit of Medicare. And those are the people that drive me nuts, or are the bad apples, is because, this is the product for you because this is what I can sell you. I'm going to putt when you should be driving.
Exactly.
And those are the times when people have negative experiences or they get put into a product that maybe wasn't right for them. And once again, is one of the reasons why I try to focus on Medicare, and I try to be really good at it. And I do just a ton of continuing education and learning about what products I have and what products are coming down the pipeline.
I love it. Yeah. It's like products themselves generally, and there's some exceptions, but products aren't what's bad. It's sometimes an advisor is bad, or an agent is they have a bad motivation behind why they're bringing something to your attention. So it's, to your point, I don't love when people have this preconceived notion about any sort of thing, thinking I don't want to even talk about that, because it's like, well, there's more to it than I'm sure what you have to think. So
it's like if we sat down and I said, all whole life insurance is a scam.
I would freak out. But what? This guy's crazy. Exactly.
That's what came to mind when you were talking about that. It's like life insurance, annuities.
Those are the two biggest ones.
People
for sure.
have, the preconceived notions on things. And like you said, it's a tool or a club in your golf bag. You can't see it's one way or another without.
Right.
They wouldn't be a thing if they had no value to anybody out there.
And they just paid a nice commission, nobody would buy it.
And it doesn't surprise me that there's like horror stories of people with Medicare Advantage or annuities or whole life insurance, because they're extremely like complicated things too. So there's one side of I can see where it's just like an agent wanting to make a sale, and he's just a bad agent because of that. I can also see it where sometimes an agent might not even understand fully what he's selling or the long-term scale of it. So that's a big part of it too. These are like really complex products, and because of that, you need to really understand what you're doing, the big picture, the whole 9 yards.
Yeah. And so like you, I'm sure there's a lot of people who are financial planners or financial advisors, but maybe they don't follow the specific niche you guys follow, you know, and it's exactly the same thing.
Yep.
Be me like talking about 401ks versus IRAs.
Yeah, right,
I'm
right.
totally out of my depth.
But that's also a reason why, you know, we
can rely on each other.
Yeah, and really wanted to bring you in, being a local guy who loves the community and does as much for the community as he does, because who is going to be, I just feel like you said, working with someone who's local instead of calling into a call center that, you know, they don't have, you can't say that for, you know, everyone, but like if they come in and sit down with you and you're face to face, you want to see that person win. I believe personally more than somebody who's sitting down at a call center from 9 to 7 who doesn't know who they are or been face to face with them. To me, that's just why I believe somebody like you,
Totally.
you know, can really benefit, or somebody else can benefit talking with you in the community.
Yeah.
It's in this business, I'm sure it's very easy, and you guys probably have some of this too. It's very easy to get desensitized to things, you know, and I have found that if I sit across from somebody and it's, you know, somebody and they're telling me about their troubles, you know, and they have come to me with a problem that I can solve. Not only am I, like you said, invested in them and I want to do what's best for them, it shows me the real weight and the gravity of their problem.
Yeah.
You know, and it's easy for me to be like, oh yeah, you know, you've got this problem, blah, 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 blah. But if I see you and I sit across from you, you're real. You know, if you're just a voice on a phone line, I may not have your best interest in mind.
Right, right.
So that's one of the reasons why I love to sit across from people. And I've had people cry in my office. I've had people, you know, come and like dance for joy, be so happy.
I believe it. Yeah.
Yeah.
I believe it.
You know, I've had the whole spectrum.
Yeah.
Yeah. And I think you said that a little better than me, but it's a testament again to how you do your business. And I think it's a really big difference maker.
And it's abundantly obvious how like smart and how knowledgeable you are about everything you're talking about. Like in this, I don't know, 15-minute time that we've talked about it, you've brought up like 7 different things that I just didn't even know about in the first place, you know? And I'm sure there's the same thing for us. There's probably a lot of financial planning things that you're just like, wow, I didn't really even know about that. So that's why it's so beneficial for us to be together and have a team and be able to say, Medicare, I know it's important, but I don't know it as well as this guy does. So talk to him.
I love and I want to give you guys some props too, and we will get to that at the end because you guys are amazing. But it's one of the reasons why nobody should be a jack of all trades. You know, I do 1 or 2 things really, really good. I don't want to try to mess with anything else because I know that if, you know, it comes to financial products, life insurance, you guys will likely do a better job than I would. You know, it doesn't mean that I don't know a whole lot about Medicare because I do. That's my lane. That's what I play in. That's what I do all day, every day. But like I said earlier, you know, if I was advising a client on an IRA or a 401k, I'd be like, go talk to your financial planner.
Right, yeah. I mean, it's like, I feel like this is such a cliche like thing to say, but it's like if I wanted to build my own deck or something, I could easily go on Google and mess around with it and look up how to build a deck and then go and get all the materials, and I would be super inefficient and I'd probably spend a lot more money and time than I would if I just told someone that builds decks every day, hey, build my deck, you know? Yeah, it's one of those things that sometimes people have to decide for themselves what makes the most sense.
When I used to teach tennis, I used to see it all the time. People would go read a book or watch a slow-mo video of somebody hitting a forehand, but they try to recreate it. And reading how to do something, knowing how to do something is really different from how you do it, yeah. You know, when it comes to physical skills, anybody who's on golf, Instagram Reels or TikTok, you know, you get sucked into it, you're like, oh my gosh, yeah.
Yep. And so easy to,
Yeah.
and then reality comes.
Then reality comes and you try it, you're like, well, I have no idea what I'm doing. So, but I really need to give you guys props. I said it earlier, but you guys are young guys, and like you had said, you are very, very sharp, both of you know, and working with people who are smart, they know their products, they're local, to me is important. I love small businesses, I love local businesses, and one of the reasons why I do so much with the Chambers of Commerce is because I want local small businesses to benefit.
Yeah.
And I love partnering with guys like you who run your business similar to me because I've got your cell phone number. I can shoot you a
Yeah.
text and say, hey, there's this case we're collaborating on. What do you think?
Yep.
Or I can shoot you a text and I can say, hey, I really need some guidance, and vice versa. You
And
guys
he
could-
does. He does. Which I love. I love that.
And so just the fact that you guys are able to collaborate with me and you guys share the vision with me for the community because you guys are young and you want our community to thrive and be around for a long time, it makes me happy that there
Yeah.
are allies that I have in this business who are in it for the right reasons and are good, high quality professionals. So I really, really wanted to take a minute to give you guys some props and sing your praises because you guys really are awesome.
Well, thank you. Thank
Yeah,
you. The feeling is mutual for sure.
Yeah.
Definitely.
Yeah. So we're pretty much wrapping it up. If listeners could walk away with one thing from, the interview basically today,
Mhm.
what would you say that is?
Shop local, whether it's your insurance, your financial planner,
Totally. Yeah.
your groceries, whatever it is, do your best to use a local resource and do what's best for you.
Amen. That's a great way to end it. I love
Yeah.
that. Yeah.
And how could people find you?
Oh, I totally forgot. Thank you. Yes.
It's important. Yeah.
I work for a company. It's called TDA Insurance and Financial. Some people know us as Kennedy Niemeyer Insurance Services. We've got an office in downtown Plymouth and an office on the lake in Walled Lake. My direct line is 248-429-9216. I have an email. It's SAD, as in David, LER, @tdanow.com. You're more than welcome to call or email me.
Yep. And we will leave all that info in the comment section as well. So it might be a little bit easier if people want to get in touch with you. But we want to thank you for coming on, especially being the first guest. We are excited to do this.
Set the bar high. That's for
Yeah.
sure.
Thank you guys for having me. This was awesome.
Exactly. Yeah, so that wraps everything up from episode 10 of the Integrity IPG podcast. We will see you guys next week. Thank you. Bye.
Medicare coverage, costs, and options vary by individual. This information is for general educational purposes only and is not a recommendation. Individuals should review their options carefully and consult appropriate professionals before making decisions. Sam Adler and TDA Insurance and Financial Agency are not affiliated with the ON Equity Sales Company or ON Investment Management Company. Securities offered through the ON Equity Sales Company, member FINRA/SIPC, 1 Financial Way, Cincinnati, Ohio, 45242, 513-794-6794. Investment advisory services offered through ON Investment Management Company.